Welcome everyone to the 6th edition of Insights, a public health webinar series by eHealth Africa. I'll be your host for today. I am Mohamed Fauci Adeniro, a project manager and a country operations and finance lead for the Polio Outbreak Control Room project in Tanzania. Today, we will be discussing the role of technology in delivery of life-saving vaccines and medicines. With me today are very knowledgeable professionals who have years of experience working in the public health and supply chain space and are very familiar with the use of technology, especially the integration of technology into the public health supply chain. The distribution of medicines and vaccines to service delivery points, I am excited about today's conversation as I am positive that myself and the audience will have a lot to gain. Should you have questions, kindly use the Q&A icon below and put your questions in there. I will be introducing the panelists alphabetically, and I'll start with Anu Oluwapo Agbola. He is a logistics and supply chain professional. He is a logistics and supply chain professional with a passion for emerging markets and economies. With over 16 years multi-sectoral experience across e-commerce, FMCG, healthcare industries, Anu is presently the country customer solutions manager at Maersk and is responsible for providing customer-centric integrated solutions amongst other functions. Welcome, Anu.
Good afternoon, everyone. Nice to be here.
Thank you. Our next panelist is pharmacist Nafiu Abdullahi. He is the Sokoto State Coaching Officer. He is a pharmacist with years of experience in public health, commodity management, and commodity securities. Attended series of training as a vaccine logistician, a master trainer in vaccine management training. He has used Open LMIS, as well as NHLMIS, that's what we call Navision. Currently undergoing his master's program in public health epidemiology at Ahmadu Bello University, Zaria. Over the years, Nafiu has engaged with partners like UNICEF, WHO, Solina, IHP, and eHealth Africa. Welcome, pharmacist Nafiu.
Thank you. Good evening, everyone. Nice to have you.
Thank you very much. Our next guest is Tahir Buhari. He's a coaching expert at eHealth Africa. He is a strategic and detail-oriented project manager at eHealth Africa with over 8 years of work experience in immunization supply chain and coaching logistics and research. He is currently managing a $2 million project where he deploys services and maintains medical coaching equipment across multiple regions in Nigeria. Tahir is also a specialist in design and implementation of field evaluations of innovation solutions to address unmet needs of primary healthcare centers in the last mile. Welcome, Tahir.
Thank you, Fauzi. Excited to be here.
And our last panelist is Umar Olufemi Musa. He's an associate with Solina Center for International Development and Research. He is passionate about health system strengthening with over 2 years frontline experience in management and coordination of health delivery in northern Nigeria. He is interested in improving maternal and child health in Nigeria and sub-Saharan African region through the formulation and effective delivery of policy strategies, especially in areas of health research, analysis, health financing, logistics, supply chain of essential commodities. Welcome, Umar.
Thank you, Fauzi. Good evening, everyone.
I'm happy to have all of you here, and I am sure the audience will be in for an exciting conversation. Just to give an overview, globally, healthcare is an important part of economic growth. However, remote and underdeveloped areas are often not able to provide same level of services as the urban cities. This has led to increased demand for healthcare services in these areas and corresponding insufficient supply of life-saving vaccines and medicines. This has further exacerbated the movement of people from the rural to the urban cities for employment, general migration, internal immigration going on, which further puts pressure on the urban cities' healthcare resources and oftentimes result in stockout in life-saving vaccines and medicines. We all know the integration of technology into healthcare delivery is seen as one of the solutions to these challenges. By integrating technology into healthcare services at last mile health facilities, we can improve supply chain management in distribution of vaccines and medicines, as well as facilitate access to healthcare delivery for beneficiaries. Today, we are looking to gain expert insight into the use of technological tools like mobile phones, software applications, cloud computing, and storage, as well as smart Internet of Things devices around smart items that have played increasing roles in improving capacity of states in the distribution of essential drugs, as well as provide accountability through data collected to assist stakeholders in making informed decisions. This is seen as an underpinning strategy to provide better services to underserved population. I'll go into the question proper. As we all know, technology. I would like the panelists to tell us their experience in using technology and the benefits, as well as the advantages of using technology. I would like to go with Anu first. Anu, over to you.
Good afternoon, everyone. Basically, technology is an enabler. So before I talk of the benefits, I'll first go to what it was pre-technology era in inverted commas. The days when you'll be moving, let's use the health logistics industry, you're moving vaccines and consumables from a central store, and you don't have any means of communicating to know where they are, the condition of the vaccines, whether there's a breakdown of vehicles, whether there's a roadblock, you just keep on hoping. And like one of the literary texts of those days will say, waiting for Godot. It's only when it gets there that it gets there. And then you now serve customers these consumables that you do not know whether it's really potent anymore. Coming to the benefits of technology, technology helps us with visibility, helps us to know where the vaccines are at per time. So it's real time. It's supposed to be real time where I can say, okay, maybe it's coming from Abuja, it's coming to Kano. Okay, at present, they've got to Kano, to Kaduna, or to Zaria. There's going to be a reduction in there's going to be an increase in the expected time of arrival because there's some traffic holdups. So there might be possible issues with potency, and we are looking at how to make sure these are mitigated. Technology has become an instrument that enables decision making because it is a veritable source of data which helps us to take informed decisions. So for me, technology is an enabler, summarily.
Thank you very much for that.
You're welcome.
I'd like to move that to Umar. Can you please tell us your experience around using technological tools and what are the advantages you've seen?
Thank you very much, Fauzi. Just to give some additional advantages to what Anoluwapo mentioned. Yes, there is visibility and better decision making that technology brings. Also, we have a bit around the availability of real-time data. Also, giving reference to the logistics industry where we move health commodities about. we may not really, have that insight into what is happening at the lower level without the use of technology. So that availability of data helps us to, make better decisions and even have improved visibility into what's happening at the lower level. I think another advantage of technology is around the elimination of paper record keeping. We have access to electronic data that actually helps us to, at any point in time, make useful decisions as to, when to make our deliveries, and even how to go about that. So we've seen a lot of technological innovations introduced, particularly in the healthcare industry. There's been a lot of support from partners as well as efforts by the government. And this has improved the way that we now operate, especially within the healthcare sector. So I'll just pause here now. Over.
Yeah, so it means there's that paradigm shift. Thank you very much for that. I'll move to the next question, and I think the best person in position to answer this is pharmacist Nafiu. What do you think is the current role of technology in the health sector, especially around distribution of vaccines and medical supply?
Thank you, Fauzi. Good evening, everyone, once again. The role of technology in delivering of vaccine can never be overemphasized. As a stakeholder in the state, Sokoto State, for the delivery of vaccine, when we talk about vaccine, let's go back to history. That we all know that vaccine was derived from organisms that's causing an infection. Let's take example of live attenuated vaccine, such as oral polio vaccine. So vaccine need a special care and special treatment when storage and also when giving. Without technology, the current movement of vaccine within the state, from the national to the state, to the LGA and to the health facility cannot be achieved. So with the use of technology and delivering of vaccine by the eHealth, through creation of applications and also moving the vaccine from one point to another point, moving the vaccine, important vaccines to the health facility, it really helped a lot in securing and also preventing the health of a child of Nigerians, particularly the northern state in Nigeria. Because we need to deliver our vaccine timely and also a potent one. So you cannot have a potent vaccine and also a time frame vaccine that can be used at the health facility without the use of technology. We have a lot of applications that we are using to track the visibility of vaccine in the health facility and also the accountability of vaccine in the health facility. So we really thank eHealth and other health partners that supported in delivery of vaccine at various health facilities. Thank you, and over.
Thank you very much for that. Tahir, would you like to add to that?
Yes, I think I would write on the comment that pharmacist Nafiu really made, that the need for technology really cannot be understated. I think I would like to paint a picture of what the EPI program is for our audience. Nigeria having one of the largest populations in the world, right? We are estimated to be around 220 million. Actually, projections by United Nations say that we will be almost 400 million by 2050. And our birth rates are about 36 births per 1,000 people, which will round out to about 7.9 to 8 million births per year. So we're talking about a huge population, and Nigeria is managing one of the largest EPI programs in the world. So the sheer size of the population and also the need for that is quite massive. The Nigerian government also imports all of the vaccines. So if you think about how we're doing that, we have to import, procure, distribute, all of these vaccines for the needs of all of these populations. Also, if you look at the architecture, for example, of the Nigerian supply chain, we have a national strategic cold store, which is based out of Abuja. That strategic cold store then distributes further down to 6 zonal stores in the 6 geopolitical zones. Then vaccines come down from those geopolitical zones to at least 6 states in each zone. And then we know historically, LGAs or local government areas collect their vaccines from the state cold store, which is that pull model. But we know all of the issues with pulling vaccines. So now there's this push to do push plus, right? So the sheer size and complexity of the immunization supply chains in Nigeria just makes it very, very complex. And that's where technology sort of comes in. The ultimate measure of success, for any supply chain, of course, is determined by the visibility and also the availability of those vaccines at the last mile and at those, service points. So for a country like Nigeria, right, if you think about that one functional PHC per ward, we are talking about at least 9,600 service points in Nigeria. So distributing vaccines to almost 9,000 locations is really a complex process. And that's where technology sort of comes in to help us understand not only what type of vaccine is needed in this particular location, but also like how do we get it in the most efficient manner possible. So it is really a very complex supply chain, as I mentioned, one of the largest in the world, only behind India, China, and some of the larger countries. So the need for technology really cannot be understated.
I would like to pick from each panelist. Anu mentioned the need for visibility. Pharmacist Nephew mentioned the importance of ensuring quality is delivered. Tahir mentioned scalability. If there's no technology, it's difficult to scale up. With the volume of vaccines moved from one end to the other, it's hard to track. Umar stated that paper trail, because I am more particular about that because I'm very passionate about the environment. Using technology reduces paper trail and helps you quickly make reports. I would use it to roll on to the next question based on what Anu said. Anu, you mentioned something about visibility, and I know it's very important to talk about visibility, transparency around distribution. How do you think technology has made it possible for accountability around tracking, transparency, and visibility around vaccines, actually, generally?
Thank you. Technology I will look at it first from the products being transferred itself, then to the logistics infrastructure via which it's been transferred. Firstly, from the vaccines, we have a lot of IoT-based technology, which helps us to be able to measure per time via indicators, which we can monitor from whichever base stations we are on the temperature in which the product is held. And this will help us know whether we need to fast track and also prepare measures to make sure that immediately the vaccine lands at the point of at the destination point, it is immediately evacuated and put into another temperature, which would have been regulated prior the arrival. It also helps us to determine the temperature of the logistics vehicle conveying. So we're looking at the in transit, destination, and where it's coming from, the potency. We also can determine the where of how far they've gone, the milestone of the journey they've gone. And the fact that we can determine to a large extent via IoT, the temperature of the vaccines helps us determine the potency. So even by the time we get to the point of destination, there might possibly be some of the products that will not really be potent anymore. And so it means it's not going to be 100% of the inventory that was transported that would be used. And there's always a provision from a percentage perspective of what might possibly fall into that category. technology will help us be able to know this and make sure that we are not beyond the provision that has been made. Anything beyond that percentage, it's a no-no. And then it means also that basis that we would, from a vendor management perspective, say, okay, if 6 vendors, like my brother said, moved from Abuja to 6 geopolitical zones, and the data deduced from all of them shows that some of the vendors that did these movements did not pass the test, they won't be opportuned at the next interventions to be called upon, because it means that via data, we're going to blacklist them. And this will be what they will also be able to see. So it's not like you are witch hunting or victimizing them. Data that can be verified is what they are all opportune to. And the prior SLAs have been committed to everybody. Everybody is signed from an informed perspective. And so when data is presented, they know, okay, I was below the positive score line expected. So I know next time I'm not going to be able to feature in this project. It also helps them to check. Even the ones that will be retained can definitely check and say, okay, I still had faults here. Where do I need to work on? Is it improve my drivers, improve my road network? Maybe they had to go through a longer route. They have to look at from the basis of route optimization and say, next time, do I go through a shorter route that keeps the potency of what I'm moving intact? It also helps them to be able to possibly change drivers. Some drivers possibly don't see the import of what they are moving, and they think it's just some dry good. And via data that is shown to them, they can say, oh, I think I need to buckle up next time. And because everybody understands what we are moving, everybody knows that they are stakeholders, very important stakeholders who all have milestones to play in making sure that the right vaccines, and by the right vaccine, we mean quantity and quality, gets to the end point. So it's not just quantity getting there, but quality haven't been lost. Quantity and quality. Thank you.
Quantity and quality. That's I can relate to this, because looking at the experience joining EHA, without technology, I don't think we would have been able to achieve what we achieved, delivering over 42 million doses of potent vaccine. That's from state cold store to last mile. Without the use of technology, I don't think it would be easy to even get that report. We used it to roll to pharmacist NAFU, focusing on distribution of vaccine and medicines with technology aiding the process. How has this improved availability of vaccines and other medicines within the last mile health facilities in Sokoto?
Thank you, Fauzi. From what I have observed, since my assumption in office as the collection officer, the availability of vaccine has increased tremendously in the Sokoto state, across the Sokoto state. In our health facilities, we have almost 303 health facilities that we are delivering vaccine to. I wonder whether if we can deliver 14 vaccine to all these health facilities at a timely base with our technology. Because vaccine has some characteristics from different from other medicines. Because for you to have a potent vaccine, that vaccine must retain its BBM stage. We have what we call BBM stage and BBM type. We have stage 1, stage 2, stage 3, and stage 4 of the BBM, vaccine vial monitor. Stage 1 and 2 is when the vaccine is potent and can be used to immunize the children. Well, when we are talking about BBM type, we are talking about type 1, type 2, type 7, type 14, and type 30. This is concerned with the stability of vaccine. Which one is more suitable at the heat exposure, at the exposure of the heat? Like type 2, we have BCG and oral polio vaccine, while for type 30, we have Fenta and hepatitis V. All these must be considered before you call a vaccine potent. So without the technology of delivering this vaccine to all the health facilities with different kilometers, because I wonder how those facilities are receiving vaccine that is potent and timely. Currently, we are undergoing a physical count at different health facilities in Kebbi State. If you went there, you will see that the same vaccine that was received from the national, at the stage of it, whether it is stage 1 or stage 2, is the same vaccine that you will meet at the health facility. So for you to have such kind of potent vaccine, you need a technology to move such vaccine from national to state to LGA, then finally to the health facilities. So if we talking about potent vaccine, we must appreciate the innovation and also the improvements in our technology, because it's one that is guaranteed. It's one that guaranteed the potent vaccine at the health facility and at the right time and at the right dose for a particular client or children to be immunized. Thank you.
Thank you very much, Pharmacist Nafiu, for that. So I will roll to Umar with this. You mentioned something very important, Pharmacist Nafiu. And Umar, with what Pharmacist Nafiu just mentioned about ensuring availability, I want you to look at how, or explain how technology has actually improved reporting and performance of vaccine usage at the last mile, as well as overall use of data for decision-making for stakeholders within the health sector. How has that really improved the overall performance?
Thank you very much, Fauzi. And so just to get right into it, so when we talk about reporting and performance of vaccine utilization, what we really mean is how well does data from the the lower level, how fast or how quickly does it get to the states, and how does that influence the decision making of stakeholders. Also, vaccine utilization really is talking about how the service providers utilize the vaccines to ensure that wastage is prevented and the vaccines are kept in the right the condition that they are supposed to be. So how has technology helped to improve reporting as well as vaccine utilization performance? So for reporting, we now have real-time data, because at the facility level, the service provider could easily, at an instant, report what quantity of vaccine stock currently exists at the facility level, and the state coaching officer at the state or even the zonal officers at the zonal level can easily see what is happening at that level. So this actually helps with decisions around, top-up deliveries of vaccines. So say a health facility reports minimal stock. So there are different levels of stock. There is the maximum, there is the minimum, and there's the stock out level. So at the minimum level, it's expected that the health facility service provider is supposed to actually, make top-up requests. So at the state level or the zonal level, when that is noticed that, okay, this health facility is about to run out of stock, what's the the stakeholder does is to reach out to make sure that vaccine top-up are delivered to the health facility. So that alone actually helps availability, actually helps ensure that there's availability of vaccines at every point. And this also, helps to ensure that service provision is not interrupted at the health facility level. So, at the tail end of everything, you discover that healthcare delivery, and service delivery is optimized in the sense that, there's always vaccines available at the health facility level in good condition. Also, when we talk about the utilization, we've mentioned a lot of things around visibility. There's also the accountability that comes with knowing exactly what is going on at the health facility level. So at the different levels of the supply chain distribution network, all stakeholders are aware that, okay, there is someone at the top level monitoring what is going on with the vaccines, how they are being moved, and how they are being ultimately utilized at the service delivery points. So with that knowledge, it actually, instills that, consciousness that I need to make sure that I use the vaccines or the commodities as I'm supposed to. So, that already drives some sense of accountability at every level. And ultimately what this does is to prevent stock out of vaccines and also, prevent wastages that may otherwise not have been possible, right? One other aspect I would just like to highlight is around targeted supervision. So with the availability of real-time data, or let's say near real-time data, it's possible for stakeholders or coaching officers at different levels to be able to, monitor what is going on, identify service delivery points or health facilities that have issues, and really, conduct targeted supervision to try and improve the situation of things. Say health facility constantly reports stock out of data. It may actually be that vaccines are being wasted. It may be that the vaccines are not sufficient for the health facility, maybe due to high client load. There's a lot of patients coming in. So by the time that is noticed over time, the stakeholders at different levels can easily say, okay, let's find out what's happening at this particular health facility and fix the issue. Without technology, you wouldn't really be able to do that, because the vaccines at the last mile are in a kind of blind spot, and you just at the top level, just be hoping that things are going on fine. So yeah, I think in terms of how technology has improved reporting and vaccine utilization, that has really changed over the years. Back to you, Fauzi. Thank you.
Thank you so much for that. Well, it stands out that wastage is there. We need to improve on quality. And I think I want Tyler to share his experience around how technology has improved the delivery of metafridges. And I'm sure he would explain what metafridges are. So the last mile, how has it improved the quality at the health facilities? Over to you, Tahir.
Thanks, Fauzi. So for those that are not familiar with the metafridge, CFD50, it's a new generation vaccine refrigerator that has remote monitoring capabilities. It's one of the cold chain equipment that has one of the most sophisticated remote monitoring systems, in that it monitors not only what is standard or what is considered standard in the industry. So, I mean, it's storage chamber temperatures and ambient temperature, but it also monitors additional data points like power. It even knows whether that power is from the grid or from, a generator. It also tracks the internal components of the fridge itself. So I worked on a project that started delivering those CFD50s to some 12 states in Nigeria starting in 2017-18. That was pre-COVID. Now, this fridge that was introduced 2017-2018 before Corona and before the COVID shutdown was designed, very much with the intention of being able to monitor the environment and how the fridge is being used, remotely. So come 2019, COVID and the shutdown, and I really found myself, thinking this kind of technology is what is needed really to drive the performance of, our cold chain and immunization supply chains. I was able to monitor exactly what was going on with the fridge from my home, seeing how many times the door was open, seeing whether that power, was coming from the grid or the generator. I found myself calling health facilities and reminding them, hey, your door is open, make sure you close it, because we want to make sure that these vaccines are not exposed to unsafe temperatures. So I think these kind of technologies really drive, performance of our immunization supply chains, with all of the, several challenges, in our supply chain, from the sheer size, as I mentioned earlier, to logistical challenges, to the vastness of Nigeria as a country, diverse terrain, constraints in terms of infrastructure. All of these things, are challenges that are really impeding the high performance of our immunization supply chain. And in the end, I think you're going to hear this word a lot: visibility, visibility, visibility. When you are able to see what is happening at that last mile, you're able to make better planning decisions, and also understand why are things happening the way that they are happening. technology can help you with, for example, forecasting, right? When there's money that is needed to procure all of the vaccines that we need for the 8 million children that are being born in Nigeria, right? If you have data, from the last mile in terms of how many vaccines are being used, the country can use that information to properly plan and forecast for the vaccine needs and for coming years. So I think that visibility point is really where technology can play a big role in the immunization supply chain. But Fauzi, there's also an important point that I really want to get across here. Technology is great, but it is not always perfect, right? If you walk into any average healthcare facility in Nigeria, you would notice that our health workers are really dealing with a lot of people that need and require service. So whatever technologies we are introducing into our health centers and our primary healthcare facilities, I think we really need to take a step back and really think, is this technology going to take away time from this health facility in charge to actually provide service to this mother? Are we introducing this technology as just another additional reporting protocol that these health workers have to, do? Or are we really critically looking at this technology and asking ourselves, is this going to provide value? Is this going to, make the job of the healthcare worker in that facility easier? And is it going to reduce the burden of that healthcare worker? So I think that is also a key point that we really need to take into account. While technology is great and perfect, it's helping us with this visibility, we really also need to think about making sure that we are not piling on so many solutions that will take away time from serving people.
Thank you for that, Tahir. And since you've mentioned the challenges, I think I'll just roll with that. Pharmacist Nafiu, as we all know, whatever is good has its own challenges, right? And what do you guys think are the major bottlenecks for adoption and scaling up of technology in the distribution of health commodities to the last mile health facilities? I'll start with Pharmacist Nafiu, if you can go. Yeah.
Thank you, Fauzi. As you have mentioned, whatever has advantage must have disadvantage. At the same time, when we mention the advantage of technology, then we will never forget to mention the disadvantage. And one of the disadvantages at the state level that we encountered and at the health facilities, we have three different disadvantages. Number one, we have a capacity gap in capacity building. Number two, we have technical know-how. And then number three, we have funding. So let me start with technical know-how. No matter how you want to teach someone how to use the application or software or a computer or a smartphone, if that person is not current and doesn't have passion and also don't know how to operate such devices, there is no way he can use the application for the visibility and accountability of the vaccine. So you need to have people that has the knowledge, basic knowledge of computer or basic knowledge of operating a smartphone. Then we have a capacity building, gap in capacity building. Sometimes you may encounter that a healthcare is a service provider has been changed from a particular facility to another facility, or a service provider or a collection officer, local government collection officer has been changed from one LGA to the health facility. So before someone can be onboarded and also know how to operate or how to use the tools in reporting of the vaccine out of stock. And hello, the background is noisy. All right. Before someone can be onboarded on how to use the application to report the stock out, to report the stock on hand, then it will take a lot of time. So you need to reorient and also develop a capacity building on such person. Thirdly, when we're talking about funding, which is the key point and major things here, if you don't have a smartphone or a mini computer that can be used for this reporting and sending of data from the health facility, then there is no way that you can account and also hold responsible for any person that didn't send the data. Currently, we are experiencing such kind of situation in Sokoto State, where you will find it very difficult for you to even get this stock on hand at each LGA. Talk more of a health facility. If you cannot get this stock on hand on weekly basis from the LGA, how can you even expect health facility in charge to send their stock on hand to the state? So with the use of technology, with the use of smartphone, this can be minimized and also this can be possible. But if the facility in charge or the LGA course officer doesn't have a smartphone, he will give a clumsy excuse that he didn't have a smartphone. That's the reason why he didn't send the report. But thank God, recently we have procured 23 smartphone, a tablet phone for our LCCOs, which were donated by the CHI for offering LMIS to send their report on the vaccine they received, vaccines they shipped to the LGA, and also the vaccine they have utilized within the time of delivering of vaccine. Such devices will really help a lot in making sure that all the LCCOs have sent their report timely, and at the same time, there is no any excuse from any LCCO that he doesn't have such kind of a device to send the report, and the data will be sent directly to the tablet phone on a monthly basis. So funding is one of the key factors here for us to have a good reporting system across the state and the health facility, as we are saying. Thank you so much, and over.
Yeah, thank you very much, Pharmacist Nafi, for that. I'll move to Anu, 2 minutes. What do you think are the bottlenecks for scaling up technology around health, last mile and health delivery?
So for me, I'm going to start from education. One of the biggest challenges is you could produce a software, you could produce the hardware, but the challenge is have the recipients for whom you have provided the technological solution, are they capable of using it? One of the biggest challenges we've always had with technology is that technology is always, we always have an inside out instead of an outside in. We need to get feelers from the target audience before creating technology so that it will be in sync with realistic challenges. Sometimes we think we know the challenges, but they are different from what the challenges really are. Once we get past this, then the next thing is always scaling, and it has to be largely convincing. A lot of people always think, oh, technology, oof, to know where I am. In fact, I was writing a few notes as one of the speakers was talking, and I found out that basically technology answers all the questions we were taught as kids in the basic English classes. The what, who, whom, how, where, when, and which would be where is it, who is in charge of what, but as regards transparency and accountability, which one, which is stock levels, when, which is time frame, how, the mediums of which it will be moved. Once we can answer this with the stakeholders at the basis level, then we will see great success. Most technology created are not successful because it's not, the user experience is not all encompassing. But when everybody knows that we're all stakeholders and the big picture is to make sure potent vaccines get to the last mile, and we know that when these guys get inoculated, it's for the good of all, mortality rates will drop, and then everybody would all have their hands on deck. So I think from technology, what we need to do is make sure that while we're about to start creating technology, everybody in the African parlance is carried along. You see a lot of initiatives failing in Africa, but somebody says, oh, no, I wasn't carried along. It's just foisted on me. Carry everybody along, and then we'll see it work.
Thank you for that. Thank you very much. Tahir, do you have something to add?
Yeah, I love this question, Fauzi. I think I'm going to come at it from a different angle. Um, I think for me, there may be 2 to 3 very, very important points that need to be addressed when we're talking about introducing technology in the system. I've been part of the teams that have sort of piloted this sort of initiatives. Pharmacist Nephew and I are working on deploying an application in Sokoto State that aims at providing visibility for temperature and storage performance for cold chain. But I think one thing that we really need, and this one I would say our government needs to do a lot more. We need to have a vision from the government as to how they see technology coming into the system, and whatever technology is being developed by partners, by donors, by development agencies needs to key into this holistic view that the government would have already agreed to have. So for example, now one of the big challenges is every single manufacturer of cold chain equipment has their own dashboard. So there's a dashboard for B Medical, there's a dashboard for doulas, there's a dashboard for Metafridge, there's a dashboard for West Frost. So how many dashboards does Pharmacist Navview have to log in every single day for him to understand the performance of cold chains in Sokoto State?
Sure.
Manufacturers are not making it easy for EPI program managers. I think the government can come in this kind of issue to make sure that whatever dashboard is being built has an API that could potentially send data, to a central system that would make it easy for Pharmacist Nephew to have holistic performance of all of his cold chains that are under his responsibility. So that's one. Creating multiple siloed systems is not going to work. Then number 2, again, that angle that I mentioned, in terms of the healthcare workers themselves, whatever it is that we are introducing, we must critically analyze and think about what is the impact that this is going to have on the day-to-day. If this is going to take away time from me from serving a mother that has brought her baby, to get immunized, then that is the technology that we should definitely not introduce in our system, that we cannot afford, because the ratio of healthcare professionals to our population is simply not sufficient. And then point number 3, I would say, is a little bit keying into that funding angle. Now, Pharmacist Nephew mentioned that there was tablets that are going to be donated to Sokoto State. Now, I was part of a project that deployed 1,400 phones in Kano. That project started in 2014, and I can tell you not a single one of those phones is existing as of today in 2022. So while it's good to also introduce technology, it's important to consider the sustainability of that technology. What happens when the tablets get spoiled? Who is responsible for replacing the tablet, right? So these are all things that are critical, introducing technology to the systems. And I think if we're able to have some sort of a grasp of that idea, I think we should definitely be in a much, much better place.
Thank you so much for that. I think I can understand the part that you said, siloed system. Instead of building, there should be a way to harmonize all the dashboard, whereby you don't keep buying different products and keep having different dashboards to monitor them. I would want Umar to add few words in 2 minutes, if you have anything to add.
Yeah, thank you. I think my fellow panelists have actually covered a lot around the challenges on the adoption and scale up of technology. Just to add a point to what Tahir mentioned around the government's aspect. So yeah, there's the part of the government having a vision. I think another angle to also look at it is, what can the partners or the private sector do to get the government on board. This is really around trying to get government buy-in right from the start. So there could be that advocacy to key government stakeholders to say, look, we're trying to introduce this technology into the country or into your states. And we would over time want you to take up management. So what that does for us is it actually helps to ensure that the government, number one, is aware, and two, they also buy into the idea, and ultimately that could ensure sustainability. In terms of the funding, it could be maybe a sort of phased system where the initial funding may be done by the partner organization or whoever is bringing that innovation. And as time goes on, maybe on a yearly basis, the government could also take up the funding percentage up until when the government is able to fully manage the process themselves. So I think that's one way we can really go about in trying to address the challenge of sustainability for the adoption of technology. Thank you.
Thank you very much for that. So the key takeaway from here is I see where we'll be able to build a confluence, where we'll be able to meet up with stakeholders between private, public, and the NGO, work together, use shared resources, think about funding, think about sustainability. So aside providing the technology, which is good, you have to think about sustaining them. I would have to say thank you everyone for these, but there are a few questions. Let's move to questions from the audience. There are a few questions here, and I can see one to pharmacist Nafiu. The first question says, the question is from Umar Abubakar. He's also a pharmacist like you. He said, are these technological devices available at all healthcare facilities across the country? If no, what is government doing to ensure availability of these devices?
Thank you, Omar, for the question. Currently, such devices are only available at the LGA level. And it is this time that we have a donation from the Chai Mental Health Access Initiative to procure such devices for the open LMIS. But we are hoping in the future, each and every health facility should get at least one tablet for reporting using open LMIS. Because once you have such a tablet, you can be reporting on the open LMIS from the health facility so that the LGA coach and officer can have an access to the health facility account. You can enter and visualize their stock out, their current stock on hand, and everything that concerns the health facility. While at the offer level, the state coaching officer can view the account of the LGA coaching officer and at the same time the account of the health facility officers, so that the state coaching officer can make a decision whenever there is current stock out in the vaccine at the health facility. He can call the attention of the LGA coaching officer to make sure that they deliver such vaccine to the affected health facility. So we are hoping in the future, the government and the partners will collaborate and provide such kind of devices to the health facility. But for now, we are starting with the LGA coaching officers. Thank you.
Thank you for that. He also asked another question, which I think we've addressed. He said, what are the demerits, if any, of these technological devices in vaccine delivery? We've discussed extensively about that. His third question is, what example of these technological devices available at Sokoto State Health Facility? We've also discussed VARO, we've discussed Open LMIS. All those technologies are at the health facilities, and they've been helping for close monitoring of vaccine quality and ensuring that the availability is there. I would move to another question. I think there are 3 other questions. Give me a second. Okay. I think I'll let Umar answer this. What are the measures that have been put in place to counter data falsification and network challenges during deliveries of vaccine to last mile? Okay, let me answer the last part, like network challenges. So in EHA, we have what we call Lomis Deliver app, where the health delivery officers handle their smartphone. They're able to record number of vaccines being delivered to a health facility. What we've done is we've made that technology in a way that they will be able to update when there's no network. It doesn't entirely depend on when there's network. When there's no network, you'll still be able to do your regular work because it has already downloaded the maps and all that for route planning for the health delivery officer. And as soon as little sign of network is detected, it uploads to the server, and you'd have the real-time update that you need. So if you look at it, we've done very well in Nigeria. There are very few areas where there's no network coverage. But for the other question, Pharmacist Nafiu and Umar, I'll leave this question for you. What have we been doing to counter falsification of data, especially from the last mile? Umar, do you want to go first? Yeah.
Okay. All right, I'll go first. Thank you. And what you mentioned around the low misdeliver application, even having that provision to upload data once there's network availability, just something akin to our if you're familiar with the use of ODK, you could actually send a report, and once there's network, it just uploads. So that's one way that we're actually solving that. But moving back to the question around how we are mitigating data falsification, I think this has to do a lot with the state officers and LG officers being at the top of their game. Why I say this is because they would have to look at the data to try to tell where it goes off. Say, for example, a health facility that receives a particular allocation, say 400 doses of vaccines in a month. If they are coming short of vaccines, or if what they're reporting is not coherent with what we've been seeing before, and this also boils down to the review of data. So when a trend line review is done, we notice we notice areas where data is not really would I say does not really match with what we may know. The officers would then try to find out what may be causing this. It may be difficult to immediately get that, but over time, when data is being reviewed, you can easily try to find out what may be going on at that health facility. So once that has been noticed, it's then for the the officers to conduct some sort of supervision at that health facility to try and find out what could be going on. And aside that, I know in the area that we operate, there's a lot of supervision, routine supervision that goes on. So when that happens, the officers go along with some sort of data to try and do some triangulation. So when they get to the health facility, they can easily check, okay, you reported this last month, what's showing on your register, what do you have left as vaccines in your cold chain equipment. So that form of triangulation actually helps with detecting data falsification. Another thing that happens is there's the conduct of review meetings where health facilities are supposed to converge at the LGA level and upload data to, say, the DHIS2 platform or the NHLMIS. So at that point, you could also detect some of these falsification errors as well. So these are some of the methods that are currently applicable to try and detect false data. Thank you.
Thank you for that. There's another question, but I'm not sure. Maybe Pharmacist Nafiu will be able to answer this, but we have just very few minutes, no more than 3 minutes. Quickly, he said, good afternoon.
Okay.
Does hepatitis vaccine require reboost dose, or it's taken once and once complete the 3 dose? And does hepatitis B vaccine also work for hepatitis C? Or one
Okay.
vaccine, or they might need to take the vaccines differently. Would you be able to answer that?
The question is breaking. The only thing that I can capture here is can hepatitis B vaccine can be used for hepatitis C? Is that right?
Yes.
Hepatitis
or do you
B
have to take different vaccines for each one?
Hepatitis B vaccine cannot be used for hepatitis C to cure to prevent hepatitis infection. Each has a separate on vaccine. But currently, we only have a hepatitis B vaccine, which we know that is more dangerous than hepatitis A and hepatitis C, but cannot be used for hepatitis C.
That's a question from Nanpak. You have your feedback. Then there is Ego Sasere. Ego Sasere is saying that thank you for the rich presentation. I am also interested in your view on sustainability. The speaker from Sokoto mentioned the donation from Chai. These devices definitely have lifespan. how do we move from dependency on external funding? Okay, that's a heavy one, and that's something we would continue to discuss. But if anyone has a response to these, I think you can go ahead and just answer.
Okay.
Okay, Famsina, go ahead, please.
Okay, he's talking about sourcing the resources within the capacity of the state.
Yeah.
Currently, it is the responsibility of the state to make this sustainable. When this, we know that these devices has a lifespan, so we are expecting the state to take the ownership and also to lead by procuring such kind of devices when these devices get to their lifespan. So we will advise the state at the same time, and also we hope the state will cooperate, and we are very sure that Sokoto State is one of the states that is really helping in terms of vaccine and vaccine activities in the state, because currently we are giving data allowances to all our LCCOs on quarterly basis, which I believe procuring devices will not be a problem for Sokoto State. Thank you.
Thank you very much for that. We are running out of time. We still have a few more questions, but it looks like we won't be able to attend to them today. I would like to say thank you very much for this, and I believe the audience too really enjoyed this conversation. For me, this brings us to the end of the exciting conversation, and our next webinar is scheduled to take place on the 12th of December.